How is childhood AML diagnosed?
So pediatric AML is diagnosed almost always via bone marrow biopsy. And although you can see evidence of the leukemia in the bloodstream just on regular lab draws, the majority of children will get a bone marrow aspirate biopsy, which is when usually the child is put to sleep for this procedure, and using a needle, they'll remove some of the marrow from inside the hip bone. And then by examining the marrow, you can determine what type of leukemia a child has and what types of mutations or other genetic alterations their leukemia has, which will determine the type of AML that a child has.
What testing does a child need to go through to be diagnosed with AML?
If a child presents to an emergency room or an urgent care or their primary care's office and a CBC or other lab tests are drawn because the kid is, feeling tired or has signs of low platelets, you can generally detect that there is something very wrong and that child should be referred to a place that takes care of pediatric oncology patients. Once the child is at a place that treats oncology patients, they can do flow cytometry to detect that this is a leukemia, it's a specific type of leukemia, and do a bone marrow biopsy.
Do children also get CML and CLL?
Children do get CML, but much more uncommonly. It's, again, primarily a disease of adults, although we do see it in children, especially in the adolescents and young adults. CLL is exceptionally uncommon. I don't think I've ever heard of a child having CLL. That's, again, a disease of older adults.